Hi there and welcome to my channel. My name is Ketelo, and on this video I'm sharing on my acne treatment journey. I have had acne since I was 8 years old, and about a year ago I finally started with the treatment. I went to see a dermatologist who is based in Bryanston Medical Center. Her name is Dr. Julia Mabu, and on the onset she confirmed that definitely I have acne, a combination of pimples, blackheads, whiteheads, permanent dark spot, anything you can think of, oily skin, blemishes. So I had a combination of those, and she definitely confirmed that I have acne and prescribed some medication for me, and I'm going to give you the details of that medication. So the first thing that she prescribed was Oratane pills, but before that the cost of the consultation was 950 rands. But before I could start with the medication, I had to do blood tests to check my cholesterol levels, my liver functioning, etc. And the blood tests, they cost about 585 rands. And then from there, she prescribed Oratane. But also before I could take the Oratane, I had to take another medication, which is Minerva, which cost 205 rands. And the purpose of Minerva was to, first of all, Minerva is a contraceptive pill. So the first purpose was to balance my hormones before I could take Oratane, which has severe side effects, but also to serve as a contraceptive to ensure that I don't fall pregnant during the course of the medication. Reason being, the Oratane medication can have severe side effects to an unborn baby. So it was for those two reasons. So I started with Minerva on the onset, which is 205 rands, after I had done the blood test to ensure that I am ready for Oratane. So I took Minerva for about a month, and then from there I started with the Oratane. And the Oratane pills, they cost about 780 rands. I don't have the exact price, but it was about 780 rands at discount. She also prescribed a hydroquinone cream. The hydroquinone cream was 137 rands. And the reason for the hydroquinone cream was to remove the permanent dark spots or dark marks that I had, because I had acne for so many years, and as a result of picking the pimples, then I had dark spots which are permanent. So the hydroquinone cream that she prescribed is actually a bleaching cream. It's one of those that they use for skin lightening and skin bleaching. But for me, it was only to remove the dark spots. So I used it for a limited amount of time just so the dark spots are off, and then I had to stop. Whilst I was taking the medication, she also recommended that I start using Dove bar soap as a face wash, use Eucerin Pigment Perfector Day Cream, use Eucerin Pigment Perfector Sunfluid, which is the sunscreen, and then use Eucerin Pigment Perfector Night Cream as well. But when I checked the prices, it was way beyond my budget at the time. So I continued with the medication, but I didn't use the night, the day, and the sunscreen cream. And then 3 months later, I went back to her, and I still paid the same fee, which is 950 rands. And then this time around, she recommended a higher dose of Oratane. So when I started, I said the Oratane was about 780 rands. No, it was about 380 rands. And then when I went back to her after 3 months, she prescribed a higher dosage of Oratane, which was now about 780 rands. So almost double the price. I had to do blood test again just to make sure that my liver is still functioning well. You know, the cholesterol levels are still okay, because Oratane can be dangerous in the body. It's a dangerous medication, hence you can only use it if it has been prescribed to you by a doctor. So I did the second blood test, which cost about 156 rands now, so it was way lesser than the first one. And then 3 months after that, again I went back to her, and she now prescribed Supatane, of which when she explained, she said it's another version of Oratane. So she prescribed Supatane, and the price for Supatane went back down to about 380 rands as well. And then on the 9th or the 10th month, I finally started using the Eucerin Day Cream, Night Cream, as well as the sunscreen. Because whilst I was using the medication, as you can see on the pictures that I'm attaching here, I could see the progress on my skin, but my skin looked very dry and it was not glowing. But I could see that the dark spots are no longer there, the pimples are fading away. I could see that difference. So I finally started with the Eucerin day cream, night cream, and the sunscreen, and that's why I started to see the glow now, because my skin was obviously moisturized. And the cost for all 3 products was around 1,500 rands. And then on my last consultation, which was about 3 months ago, I was now done with the medication, which is the Supatane or Oratane medication, and she then prescribed a cream instead of pills. And the name of the cream is Differin. I'm gonna attach it now. And she said basically the purpose of Differin cream is to continue to clear the skin of the pimples and the acne. So it does the same function as the pills, but it works on the outside as compared to the medication that works on the hormones and balances what is within. So on average, I would say in terms of cost, a month I needed to have about 2,500 rands to 3,000 rands for the consultation, the medication, as well as the day cream, night cream, and sunscreen. So roughly I would say about 2.5 to 3,000 rands a month. That is more or less it when it comes to the cost. And now I'm gonna share on the side effects. One of them, which I've already mentioned, is the effects on the unborn baby. So you cannot fall pregnant. In fact, if you happen to fall pregnant while it's on this medication, the doctors will advise you to abort the baby. The second side effects that I experienced was being extremely tired. And another side effect is having extremely dry lips. Another side effect is dry eyes, especially if you are walking outside on a windy day, the eyes become dry and teary. And another side effect is mood swings and depression. Also, the doctor did warn me about that. But I honestly, for someone that has suffered depression before, I didn't want to accept that this medication does contribute to depression. But I did experience minor episodes of depression as well as mood swings. And just to wrap up this video, this is how my skin looks as of today, and it's been almost there, and it's been 11 months, almost a year since I started with the treatment. And I don't know if it's from the quality of the video. On your side, it's clearly visible, but this is more or less what my skin looks like at the moment, and I'm happy with the progress. And I still get a few pimple breaks now and again, but also I've learned something new in my life: not to touch my face, not to touch the pimple, not to squeeze them. So if they appear, I leave them until they disappear on their own, without squeezing, without touching. So that is also something that contributes on the progress and the recovery of the skin. I hope this inspires you in some way and gives you hope. And most importantly, if you've got skin problems, that it encourages you to start treatment as well. Thank you so much for watching. Till next time.